Strike on today here in the United Kingdom, one of many, of course. We've got the rail strike, the postal strike. In fact, the only person that's not on strike, I think, is me. Could do if the Horlicks runs out, do you know what I'm saying? But the bigger story over here is, for the very first time in their history, the nurses have decided to go on strike. But really, how true is their, shall we say, demand for payment? As ever, let me explain. A lot of people over here are rather aggrieved at the National Health Service simply because it's overrun. It's always in crisis mode. It's on the verge of collapse. That's what the media tell us every single winter. The reason why it's on the verge of collapse is quite simple. We're taking in way too many illegal migrants. They're fast-tracked into hospitals for medical checks, while the people paying the taxes, you and me, are swept to one side. But the bigger picture with the NHS and the fact that they're not paying the staff that they should be paying is simply this. When you consider they're still advertising for endless media managers, endless diversity managers. But a lot of people are also asking, where does the money go from this? Let me explain. You will note, of course, that lots of TV channels often film in hospitals, doctor surgeries, GPs behind closed doors, emergency ward, that sort of stuff. They're normally on as entertainment fodder. Quite cheap to produce because simply, they're just as a cameraman, a camera crew, and some kind of loose director wandering around chatting to patients who don't get paid but get to ask to sign off so that basically they can't come back afterwards and say they want full payment. But what about the doctors and nurses? Well, in some cases they do get paid. That's right, just a small fee. But the hospital, or indeed the GP practice, can pick up thousands of pounds, particularly if it's a reoccurring series. In fact, one person told me that the hospital actually now blocks out periods for filming. So popular is that hospital. So if they're in crisis, where does all of that money go? That's exactly what the British public would like to know. And also, while we're at it, what happened to the millions upon millions that Captain Sir Tom Moore? What happened to his money? Because seemingly we simply do not know where that's gone, and that was all raised, of course, for the good of the NHS. So while a lot of people are criticising the nurses for going on strike, if they were to look towards their paymasters and say, well, where does that money go? Why can't we afford this bit of equipment? Why can't we have a Christmas party? Whatever that may be, lots of people support them. They simply don't support the management, the top tier, that continue to employ media managers, that's right, race relations managers at 80 to 90,000 pounds a year, who simply tell the staff how to be a little bit more inclusive. Now, in my day, that used to be called common sense. Surely, even the nurses understand that particular medical term. Neil Sean in the very heart of London.